be doing a assessment of the eyes and the ears. First, start off perform hand hygiene. Introduce yourself to your patient, and then explain what you'll be doing. So I'm going to start off with the eye assessment. Could I just have you remove your glasses? And then starting off with inspection, looking at the eyebrows, looking at the distribution, the skin around the eyebrows, which all looks healthy, no dryness. Looking at the eyelashes, again for distribution, looking to see if there's any crusting or drainage around the eyes, which there is not, and it looks evenly distributed. The sclera of the eyes is white, which is normal. There's no drainage. I'm going to pull down on your bottom eyelids and look at your conjunctiva.
Okay.
And can you look up for me? They look pink, and which is normal. I'm looking at the eyelids, making sure that they close all the way, which they do. Next, I'm just going to shine a light kind of on the side of your eye and look at your cornea. So if you look straight ahead for me. Looking at the cornea and the pupil for clarity and smoothness, which that one is. And the right eye is as well. I'm also looking to see that the pupils are round and they're the same size. Next, we're going to do the visual acuity test. I'm just going to use this mobile Snellen eye chart. You can put your glasses back on. And I'm just going to have you cover one eye and then read as far down as many lines as you can. You ready?
Start with this one?
Yeah, that's fine.
EFPTOZLPED EDFCZP FBLOPZD DEFTO something. That's all I can read.
That's okay. And then the other one?
EFPTOZLPED PECFD FELOPZD DHFZOPEC L something something. That's all.
Good. So the left eye was to line 8 and the right was to line 9, which is 20/20, which is a normal finding. So your vision is good with your glasses. Next, we're going to do test the extraocular muscles. So I'm going to do the cardinal directions. I'm just going to have you follow my finger. Just follow my finger with your eyes and don't move your head. Good. And she was able to do all those movements, and there was no nystagmus present or shaking of the eyes, which is a normal finding. Next, we're going to do the cover test. So what I'm going to do is have you look straight ahead, and I'm going to cover one of your eyes, and then I'm going to remove my hand with you just looking straight ahead the whole time. glasses again for this one. Ready?
Mhm.
I'm gonna do the other one. Good. So, just looking to see that when I remove the hand, that one of the eyes isn't moving back into place, which would indicate some strabismus is present. Both of them were looking directly ahead the whole time, so that's normal. Should leave these off for now. So next we're going to do light reflex test. So I'm going to shine this light right like in between your eyes. I'll just have you look straight ahead again, and I'm just looking at where the light reflects in your pupils, and it should be at the same point on both eyes, which it is. So that's normal as well. Next, we're going to do the peripheral vision test. So I'm going to have you, I'm going to move my hands into your visual field, and you just tell me when you can see both of my fingers moving. You ready?
Glasses up.
No, you can put them on for this one. Just tell me when you see both.
Yeah. Now. 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 Now.
Good. Those are all normal angles. Next, we're going to test for convergence and accommodation. So what I'm going to do is I'm going to hold up the pen light and just have you look at the end of it. And I'm going to move it closer, and you just keep following where the pen is. You ready?
Mhm.
Good. And I'm looking to see that her eyes were converging and the pupils are constricting, which they both did. So our eyes are positive for accommodation. Next, we're going to do the pupil response to light. Now I'm going to shine the light again, if I can get it to work. And I'll have you remove your glasses. And I'm just going to shine it in one eye at a time, and you can just look at the wall, look at the lamp right over there. And I'm also looking at the other eye to make sure that both of them are constricting. When I place my hand there, which it is. Good. So the pupils are constricting to the light, and
Glasses.
you click on, and they're about a 4 when they're not, the light's not being shined in them, which is normal as well. So the pupils were clear, equal in size, round, reactive to light, and accommodating. So that's Perla, which is what we're looking for. Then I would do the ophthalmoscope exam if I had an ophthalmoscope, and I'd just be looking at the structures in the back of the eye, the optic disc, the macula, the arteries and veins, and I would also do the light reflex test, or the red light test with that. So that's it for the eyes. Next we're going to move on to the ears, and we'll first start off with just inspecting the ears. So I'm just going to have to move your hair back. And I'm just looking, if the ears are symmetrical, which they are. The tops are right about midline with the eyes, which they should be. I'm looking for any inflammation, discharge, any kind of abnormalities, which I don't see. Looking at the angle of attachment, which looks like it's less than 10 degrees on both sides, which is normal. Next, I'm going to palpate the ears, and then I'm just gonna see if there's any tenderness, palpate the pinna, as well as the tragus.
Better.
Yeah, you good?
Mm-hmm.
And just tell me if you're feeling any kind of pain or tenderness. Anything?
No.
I'll do the other one as well. Any pain or tenderness? No.
No.
While I'm doing that, I'll also do a tug test. So I'm just gonna gently tug on the pinna and the tragus, just to see if there's any kind of inflammation of the ear canal. Feeling any pain with that?
No.
What about there? Do the other one?
Go like this.
Thank you.
Mm-hmm.
Anything?
No.
Good. Next we could do the Weber test. So for that we need a tuning fork, but I'm going to use this regular fork. And what I do for the Weber test is I would hit the tuning fork and I place it in the middle of the patient's head. And I would just have them tell me which ear they heard the sound in. And they should be hearing it in both ears. If they heard it in one louder than the other, that would indicate some kind of hearing loss, either sensory, neural, or conductive, depending on the results of that. And then we'd also use the tuning fork to do the RIN test, or Rene test. I'm not exactly sure which way it's pronounced. And we would hit the tuning fork again. I would put it on the mastoid process of the patient and have them tell me when they stopped hearing it, and then hold the tuning fork in front of the ear and see how long, if they could still hear it and how long. And that's testing air conduction versus bone conduction, which air conduction should be twice as long as bone conduction for the normal result. If they could hear it longer on the bone than in the air, that would indicate some conductive hearing loss, or middle ear hearing loss. Next, we're going to do, I think the last one for the ear would be the Romberg test. It's just testing the equilibrium, which is associated with the cranial nerve 8, the vestibulocochlear nerve. So let's have you stand up. And I'm going to have you close your eyes and hold your first hold your hands straight out in front of you, like that.
Mm-hmm.
You can stand this way so I can be here if you sway a little bit. Put your feet together. And close your eyes. Just try to maintain your balance. Good. You got your eyes. We're also going to do the whisper test. So I'm just going to occlude one ear and then whisper a couple letters and numbers, and then have you repeat them back to me, all right?
3-5-B.
Good. And the other one?
1-2-H.
Good. And then another test you do for the ear, if you had a otoscope, would be to look into the patient's ear with the otoscope, and for an adult, you would pull up and back on the pinna. For a child, you would pull down and back, and then just gently place it into the ear without touching the ear canal, and look at the tympanic membrane, which should be kind of like a gray, pearly color. There shouldn't be any redness or inflammation going on in there. And you'd also check the light reflex for the inner ear. And that's it.